Hello everyone, I am Berk. When we talk about penis enlargement, are we referring to length, thickness, or both? This is quite important because right now we don't have a method that can satisfy both at the same time, meaning both length and thickness. Yes, there is some thickening with our non-surgical penis enlargement. I'll talk about it a little later, but the thickening there is a satisfactory thickening like in stuffing or oil. It's not happening. In short, there are many methods that are theoretically available and currently practiced, but worldwide there are only one or two methods. These are the most commonly performed ones. These are also the methods we encounter the most in practice. These are the most commonly performed ones. These are the methods we encounter the most in practice. They are conducted in more medical and scientific studies, and the results are not very clear. So, the history of this is not as strong as the methods I will explain shortly, because it doesn't hold up very well. We have some concerns. These are the methods we most commonly apply right now. If you've decided to go for penis enlargement, will thickening be the priority, or will lengthening be more important? We need to make a decision about this, or if we're going to do both, then we need to perform some procedures one after the other. For example, if we're only going to increase the length, it can be done in two ways. Here are two methods known to the public, one surgical and one non-surgical. In the surgical method, there is a ligament that holds the penis at the top, which we call the pubic bone. That ligament is cut. After this ligament is cut, generally, retraction devices need to be used for a while and are recommended. Many people are already doing it this way. Our goal here is to achieve an increase in length of 1 to 3 centimeters in the penis. In the non-surgical method, retraction devices are used much more actively. It can sometimes extend from 6 months to a year. It can vary in durations. Also, for those who have some issues with firmness, treatments like PRP and shockwave therapy can be added once a month to increase penis capacity. We have a non-surgical penis enlargement video. That video has the details on this. I'll put it right at the end of the video. You can watch that from there too. Our goal here is the same. There is an increase in length of 1 to 3 cm. There isn't a big difference between the two methods when it comes to length increase. In fact, it's suggested like this. I will explain it in the next video or the one after that. Here, they say that the non-surgical method should be recommended as the first step treatment for those who want to lengthen their penis, so there isn't a big difference. One advantage of non-surgical enlargement, this of course isn't as much as the thickness increase over there, but you can achieve about a 1 centimeters increase in thickness as well, since you're increasing blood flow to the penis and improving oxygenation inside the penis with care, and so on. But of course, if a person really wants thickness and their penis is thin, then the thickness here isn't satisfying. If only thickness increases to be done, there are currently two methods that are most commonly used in the world. A fat injection. Fats taken from the abdominal area of the body are prepared and injected into the penis. And also there's filler injection. Currently, hyaluronic acid is the most commonly used filler material in the world. This method, that is filler injection, is becoming increasingly popular around the world because it can be done in a very short time under clinical conditions. The complication rate is very low, and for me, I've been doing filler injections for a long time. I no longer perform fat injections. The biggest advantage here is that it can be applied repeatedly. So the smallest one, in case of any disruption or decrease, you can add back 1 sound, 2 sounds, or 3 sounds. We also have a video related to this. You can watch that too. We have a video related to this as well. You can watch that too. In both cases, there really isn't a limit to the thickness increase. Our goal is to thicken, but there's no limit. More will increase it. But there is no limit here. So if you give too much, then the thickness will increase even more. But in the end, this is also an aesthetic procedure. Achieving a penis that looks like a ball will distort aesthetic perception. We pay attention to aesthetics. Patients want it thicker, but we shouldn't go overboard. There are no strict limits. Prioritize the aspect of... So, we do pay attention to aesthetics as well. Of course, patients sometimes want it to be thicker and thicker, but we shouldn't go overboard. However, we should also know that there are no strict limits in the end when it comes to penis enlargement. If you know which aspect you want to prioritize, you should go for that approach. Now, if you say, I want both lengthening and thickening, You can choose one of these methods for lengthening first, and then the second method can be thickening. I don't do thickening during the lengthening process. For example, when we perform surgical thickening, I don't do the thickening at the same time after cutting the ligament, because when we use traction devices, this can cause shifts in the filler material we provide. In the filling material we provide, there can be changes in position because you're holding the penis, pulling it, stretching it, and so on. So generally, for those who want both, I first perform the lengthening procedure. After completing the lengthening and achieving a range of 1 to 3 centimeters, if the patient is happy, I proceed to the second stage, which is thickening. For those who want thickness, I only do thickening. Then the lengthening can be done. So if they want, that can be done after a certain period. But generally, those who only want thickness increased don't have any problems related to length. As a result, neither method leads to both thickening and lengthening in the same way. A single method doesn't achieve both. We need to pay attention to this. When it comes to penis enlargement, we need to think of lengthening and thickening as separate procedures. Thank you.